My name is Antoinette Bediako-Bowan. I'm a general surgery by training, practice a lot in colorectal surgery. And I'm a senior lecturer in the University of Ghana Medical School in the Department of Surgery. Currently, I'm the PI for a project that's ICARS funded, which is identifying challenges in antibiotic use in surgical services and implementing an evidence-based interventions. In Ghana, we talk about there being high use of antibiotics, all right? And there have been studies that have shown that a third of these antibiotics are used as surgical antibiotic prophylaxis. That's antibiotics that are given before surgery so that we reduce infections after surgery. And the other thing is that in Ghana, a third of infections that are acquired in the hospital are said to be because they had surgery. They are surgical site infections, which are infections that are acquired after surgery. So the problem for us is that there are high rates of surgical site infections in Ghana, and we are using surgical antibiotic prophylaxis also. We are in the preparatory phase that we are getting ethical approval to go into hospitals. We have started visiting the hospitals that we have in mind. And we hopefully will start collecting baseline data to tell us exactly what the problem is as it pertains now. And then our thing is to find what the problems are by doing, studies, but also asking questions as to why we do what we do. So that if we know why we do what we do, we can sit together and find solutions to the problem and try and see if changing our behavior would help us change the way we practice in terms of antibiotic use. If you want to do something in MMR, it's basically finding exactly what you want to do and then knowing how to measure the problem so that if you put certain things in place, you would actually see a difference in the problem.